It's just finding one thing and experimenting with making it slightly different and doing it in a way that feels safe for you, because it's just not going to be helpful to try and drastically change everything.
Hypervigilance term also makes me think of a question that comes up, which is how to distinguish between things that you do that are kind of safety behaviors and things that you do because they provide a physical benefit, and whether you should continue with those safety behaviors because it makes you feel better or gives you peace of mind, or if you should try to kind of work your way out of doing those all the time.
Yeah, it's not an easy one, and that's where finding a good therapist or psychologist is really helpful, because it's so individual, right? I guess in the process of therapy, what you do is you look at all the things that you're doing to cope with the symptoms, and you're looking at which ones might have an impact on increasing anxiety or maintaining anxiety, and also which ones might be perpetuating thoughts about your ability to cope or about symptoms, in an unhelpful way. And so if you can see the link between some of these safety behaviors or avoidance behaviors in maintaining anxiety and some of these thought processes, then you can experiment. So if I give the example, if I get starting to get some kind of pain signaling that I might have a rough time when I go to the toilet, then if I was due to go out with a friend, I might not, because I think I'm going to get a flare up and then it's going to be awful. So we can see the link there, because avoiding increases my kind of perception that I'm going to have a flare up and that it's going to be awful and I'm not going to be able to cope. So that those are quite anxious thoughts. And also it prevents me from seeing that might not happen, because I've kind of shielded myself from it. So I can't see an alternative outcome. So it maintains that thought process. And then with the anxiety, although it might reduce my anxiety in the short term, because it maintains those thought processes, that anxiety is maintained to the long term, because next time the same things happen, I don't feel like I'm able to cope. So it's trying to work those things out. But again, I think with all of these things, we might have worked out a million ways to cope, and some of them, a lot of them might not be helpful. But it's not about doing everything different. It's just finding one thing and experimenting with making it slightly different and doing it in a way that feels safe for you, because it's just not going to be helpful to try and drastically change everything, because anxiety is going to be sky high.
Yeah, that makes sense. That sort of raises the topic of giving up going to social events. That happens very frequently with UTI, because it's so difficult to know what the bathroom situation will be, if you'll be able to get to antibiotics, if that's your go-to. But there's also the question of UTIs after sex, and this is clearly an issue for many people, and they therefore just don't have sex anymore. Is there a way that we can kind of deal with the anxiety around that topic to enable ourselves to try, or just to deal with the loss of sex from our lives?
Yeah, it's really difficult, because we know that there is a link. If you're prone to get infections, then having sex not only irritates it down there, if you're already kind of having increased sensations down there, but it might increase that likelihood. I suppose again, it's kind of seeing where you are. So if you sometimes manage to have sex and you don't get an infection, then I think logging those instances can be really helpful, because what happens is we only think about the times that we had sex and then we got an infection. So so it outweighs it, because it's so awful when we did get one. So we point to that 2 examples rather than the 5 examples where we didn't. I think that's one thing, trying to balance that out and being a bit, again, sometimes it might seem very can't think of the word, but almost scientific. But what we're trying to do is when we're kind of anxious because of our physical health, and because of experiences that we're going through, that anxiety then kind of rules a lot of stuff, in terms of how we see things in our perspective, and it shapes the information that we're more likely to get in. So I think, when we do write down and record things, it enables us to actually see a perspective that we're not always able to see because we're coming from a place of worry. So that's one thing. I think the other thing as well is, I mean, everybody, I'm sure, with recurrent UTIs will know the standard, the gold standard of peeing before, peeing after. And if you want, you can add, just washing with water or something to be extra sure. And I suppose this is where, you were asking about previously safety behaviors and where they're helpful, where they're not. But I think sometimes you can use them as scaffolding as well. So if you're trying out having sex, maybe you could, have, a course of antibiotics that you've got on hand ready, so you don't feel like you're going to be caught short if anything goes wrong. Or I guess the other thing is, if you're completely avoiding it, is knowing that it doesn't have to be full penetrative sex. And this is a thing that I talk about a lot with my clients, is that I think, we could talk for months, I'm sure, about societal messages around sex and what it should be and how we should feel and everything. But I guess sex is meant to be a connecting experience, and if you're feeling entirely anxious about it, then it's not going to be that. But if you can find ways to connect with your partner, to get pleasure still, but there doesn't have to be any penetration, that could be a nice a way to kind of gradually experiment to see if at some point you're ready to try penetration. Because as well, we know if you are hugely anxious, it has an impact on natural lubrication and all of the rest of it, and then you're more likely to get irritation. So it might not be you're getting a UTI, but you're getting sensations of irritation. So again, I guess again, it's that gradual approach. But I always encourage people to just have that agreement with and this is where communication comes in. Have that agreement with your partner that I want to be close to you, and I want to be intimate in that way, but I'm hugely worried that this is going to culminate in an infection. So can we agree to just fool around and not have sex and just see how it goes, and we'll do that for a while and see how that feels, and then maybe on your terms at some point you can try. And also the agreement that even if you do try, it doesn't have to go all the way. So if you try, it doesn't have to culminate in orgasms all around. It can just be like, okay, we tried a little bit. Yeah
I think that's a good approach, and that is one of our questions, is whether you have any advice on how to raise the topic with a partner, because a lot of people find that in itself very anxiety inducing for many reasons, and aren't sure how to broach the topic, and therefore feel stress just thinking about it, or the pressure to have sex that's there. Even if they haven't spoken about it, they assume that it's there. Do you have advice on how to broach that topic?
I mean, I think that pressure to have it without speaking about it is almost worse than having that conversation. Well, I say that obviously it depends on your partner and how that is likely to go down, but it is a broader issue in that sense, because if you're in a loving relationship where you generally feel like it's trusting and it's loving and you've got their support, then that feels like a safe place to have that conversation. I guess if it doesn't, and there does feel like a degree of kind of judgment and that this is kind of used against you, I guess that's where I would be wanting to seek advice from someone objective, whether that's a friend that can be objective for you, or whether that's like a mental health professional or a relationship counselor, because it can be really difficult. Because sometimes I've heard the way partners have reacted, and I feel like that's completely out of line, out of order. But again, you know, we can't assume that our partners are the most skilled people in these things either, and they're coming from an emotional place. So sometimes it is just about getting on the same page. And quite honestly, the only way couples can do that sometimes is by having that expertise of a relationship counselor, and then it can really transform things. But I suppose that's it, if it feels unsafe to broach it because of how you feel your partner would react. But then if it feels like they're generally supportive and it's something that you could broach, it just feels really, really scary. I think, you know, you can prepare for it. So you can, you know, get all your thoughts down on paper, what you want to say. And the key thing is, you know, get all your feelings out on paper, get all the thoughts, all the worries, all the anxieties. And then you've kind of, you know, got that kind of a bit clearer, it's out, rather than just being stuck in your brain, which can be really intangible and confusing. And then what you're thinking about is, what's the outcome that I want from this conversation? Is it just that I want them to know how I'm feeling, or is it that I want us to have some sort of, you know, graded sex life that kind of paces up, or is it that I completely don't want a sex life ever again? So it's kind of knowing what you want out of that conversation, and again, because it is a partnership, what you're willing to compromise on. So if you don't ever want sex again, and you know that they're not going to stand for that, it's finding what you're going to be willing to compromise on and coming up with, so having an idea of what your outcome's going to be and what, you know, point you'd like to get to, but also, you know, having a clear understanding of just what you want them to know. And then also just with the understanding that they're also going to have feelings, and that will feel really, really personal because you're the one that's having to struggle with all of this. And it might feel really unfair, but I think, you know, giving them permission to feel what they feel as well, which can be difficult. And again, you know, using things like breathing practices can help us not, you know, go to that straight reactive place. Oh, well, we go there, but kind of calm down from that straight reactive place, and allow them to kind of express how they feel without, you know, equating that to you failing in any way or you being the problem, and then coming back to that end goal of what you want from that conversation, because then you both feel heard and you've both got an outcome that you can, you know, problem solve together. We want to get to here, so how are we going to do it? And you can negotiate those terms.